Dr. Bhavani Raina.
Yeah.
Dr. Bhavani Raina from Jammu. I suppose you are from Jammu? Yes. Can we have gender neutral medical fields?
Good afternoon, everyone, and thank you AIOS for providing me with the opportunity. I shall be it's not coming there. I shall be talking about, can we have a gender neutral medical field? So I start with a very cliched statement that women have proved themselves in every profession. Then I add one more cliche to it. There is still a gender bias in all walks of life, and medical field is not an exception to it. And this goes beyond the boundaries and beyond the borders. So in a developed country like UK, there are more CEOs named David or Dave than there are all women CEOs together. When we come to India, 50% of students joining the medical stream in India are females, which is a good sign. But unfortunately, only 1/3 of the postgraduate students are females. And if we do a shedding, the number gets skewed down when it comes to surgical branches like general surgery, ENT, and ophthalmology. And here, I am not talking about traditionally held female jobs like gynae and ops, which for centuries have been considered to be a female's responsibility. The Association of Surgeons of India has 32,000 members, but only 12.5% are female. When it comes to All India Ophthalmological Society, we have seen only 2 female presidents since its inception in 1930, and ophthalmology is a branch which has a huge amount of female representation. In India, there are only 18% women in leadership position, and most females are working as frontline workers. And also the ladies who take up surgical branches eventually settle for academic or research-based profiles rather than going into active clinical practice. That is probably because the ladies have to take care of the families also, which is traditionally considered to be their first and foremost duty. So starting from the residency days, a female surgeon has a very uphill task. When it comes to my story, well, ophthalmology is considered to be a refined branch, and anything that is refined is considered to be a female's calling, because we have been doing embroidery and knitting and needling since ages. However, the moment you enter into a stage where you are in a position of authority, the trouble starts. The subordinate staff, they are not very keen in taking orders. Junior colleagues take time to adjust to you, and they try to surpass and bypass you. We are grouped with the nursing staff. Here I do not mean any disrespect to them, but there is a mentality you can't see female in a position of authority. It is difficult to obtain a patient's trust. I once operated upon a patient, and the next day the lady, and she was a female patient, she said, "Doctor साहब आप लड़की थे ना, इसीलिए हम थोड़ा सा घबरा रहे थे." So surgery is associated with showmanship, strength, and flamboyance, and these things are easily associated with males and not with females. The higher ups, they are either condescending, and at times they are downright biased. It is simply like, yaar isko chodo, isko rehne do, give the work to some other male colleague. You have to break the glass ceiling, and many times you are not involved in the post-surgery camaraderie sessions. Complications at the hands of a female surgeon are discussed and dissected to shreds, and they are sometimes passed as anecdotes. Opinions and ideas are not given consideration, and when you start speaking loudly, they say, "She's very aggressive." Any kind of personal growth, it requires technical training, and more than that, it requires role models, mentorship, and support groups. Now, most of the females of my age have been mentored by male seniors, and we owe a lot to them. But if you have a female who is in a position of authority, the younger female surgeons will look up to her. They can understand that if she has reached this stage, in spite and despite of all the difficulties along the way, they can do the same. So it is very important to have examples. So what we need is, we need more representation and more women in positions of authority and decision making. So in short, what do we need? We need women leaders. And yes, women leaders who welcome females. Now why I emphasize this statement is, I am a senior colleague in my institute. So we get the postgraduate students. So my tendency is I'll take the male postgraduate student and give my junior colleague the female postgraduate student. So there is a barrier in my mind also. Unless and until I'm able to get over this barrier in my own mind, how do I expect my male colleague to get over this barrier? Another point is, as a junior female surgeon, it is very important that you prove yourselves and you don't come every time that you have family issues, so you can't do this job. You have to compete in an open world and you have to do same amount of work as your male colleague is doing. So it is a both way, flow. Then only we can move forward. Excelling in surgical specialties is a very long journey, and if the surgeon is a lady, it is a difficult trek, just like a trek through the mountains. So I'm leaving you with photographs of 3 very inspiring ladies. One is Dr. Anandi Bai Joshi. She was probably the first female allopathic doctor from our country, and she died at a very young age of tuberculosis. Other is Dr. Elizabeth Blackwell. She is probably the first female surgeon and the first black surgeon actually. And then we have our Padma Shri, Dr. Padmaja. She is a burn survivor and herself a pioneer in burn treatment. So a wholesome growth needs a wholesome team, and a team can be wholesome only if it is all inclusive. It has representation from all the genders and at odd levels of hierarchy, not that the administration is in hands of one gender and the menial work is being done by the other gender. So we need equal representation at equal point, and then only we can flourish, and this gender world will just go out of this medical jargon. Thank you.
Thank you, Dr. Bhavani. मैडम ऑप्थेल्मोलॉजी में तो अब लेडीज़ ही ज़्यादा हैं. एटलीस्ट मैं देखता हूँ आपने यहाँ रोहतक के आसपास, तो वहाँ पे लड़के कम हैं. और डॉक्टर प्रियम कुछ कहना चाह रही हैं.
Society, male surgeon dominated society. So the thing is, as you have rightly pointed out, that we have to work hard. Definitely, we should not have any bias in our minds, and then we have to prove ourselves. Yes, this extra effort, this extra step we need to take, we have to take, because we have to prove ourselves amongst no grudges, no bias against anyone, but we have to prove us amongst the male surgeons. Like where I work, in that place also, if you have a female patient, the female patients would also ask, like, "Aankh kaun banayega?" Okay, so if they come to know ki, they will be ki yes, male banayega to achhi banayega. If it's a female, to they tend to stop and think. But then you have to break those things. You have to break the ceiling. Like how? So this thing happened at my workplace as well. Now you have to give an answer. But you have to give an answer that has to be in a way that provides some support to, yes, you are good at your things. So I was facing these issues at my workplace. So what did I do? I recently operated on both the eyes of my father. And yes, so this is the answer. So my patients now I have, you can go ahead with whatever you want. You can't remove this deeply ingrained bias in them ki male surgeons are better. But then to prove yourself, first you have to prove yourself to yourself. Okay, that yes, I am able to do it. Females definitely have a stronger emotional part. Yes, that may pull them back sometimes. But then we need to overcome that. We have to cross that barrier, and once we prove it to ourselves, we can prove it to others. Then I think at least there will be no need of proving then.
Actually, so I have a distinct point in my department. So there are 2-3 females and we have 1 male. So sometimes I feel that the subordinate staff will ask him whether we should do it, and if he says yes, then they will tell the other staff, "Sir bol chuke hain, isliye kar lijiye." So what I do is I call all of them together, make them sit together, and then I ask everyone's opinion. And whichever, whatever the point, whichever the majority suggests, we go with it. One thing, and I always give support to all my staff, whether it's a male staff, the female staff, I like to move them up so that they feel they are wanted and they are equally important. So, we have also to remove those barriers, then only we can.
Right, the change begins with us.
With us only.
Right.
Thank you, madam. Thank you. We'll now call the next speaker.
Change nahi chahiye ki we dominate over
Dr.
each
Dinesh
other.
Verma from Goa and Scotland. Please, sir, come.
Okay.
Thank you, Dr.
Just want to
Bhavani.
make one point. I agree with both of you totally. And this was the situation about 20 years ago in UK. But they have really, really changed. Now women are in leadership positions, in surgical specialties and ophthalmologies. There definitely it is in majority. I don't think in India is still in majority. Women there are in majority. The only thing I don't agree with your assertion that to prove yourself you have to operate on your parent. I would never do that. It is unethical in UK. You should not operate on your relatives. I know it's very common in India, people do that. And there are two reasons for that. One is if supposing something goes wrong, for the patient there is no comeback. You know, he's not going to sue your daughter or your son. And the other one is your emotional attachment. Because we are taught to be objective when you're treating a patient, so that decision making, emotion doesn't come into it. And that part you can never do with a parent. I would never operate on any close relative.
Thank you, sir. Please
Yes,
come forward
sir,
for your presentation, sir.
There are two sides.
We have 3
I would
speakers
like to
left.
say. There are two sides to this thing.
If
I
time is
agree
there,
to
we
the
can discuss
emotional
again,
part,
sir.
but then we have to overcome that part. Yes, definitely.
So actually,
So just one quick comment, because having a wife also as a doctor, not just limit to the field of ophthalmology. I feel females have already breached that thing, at least in the metros. The only thing that the problem which I see, being the other half of my wife, is that where there's licensing for the referral, it is where there are things they really cannot breach that barrier. So that is the only thing that is left to be breached. Rest, I think things have already been taken care of.
you mean the networking?
Yeah,
We are not
networking,
very
yeah.
good at networking.
Thank you,
Not,
sir.
not good.
Not good, but
We could just like easier for males in that, because we can have a sip of
I
drink
said
and
those
yeah.
post-surgical sessions.
So please, no more